Hello, I'm Andrea and I'm a continence advisor, and I work with people who have bladder or bowel control problems and with the people who care for them. In this segment of our learning series, we will look at how to manage bowel incontinence at home. When supporting someone who is incontinent, simple things like maintaining a regular bowel habit can make all the difference to a person's quality of life and reduce the likelihood of accidents.
What sorts of bowel habits are normal?
The range of normal for bowel motion ranges from anything from 3 times a day through to every 3rd day. What is important is that the bowel habit is regular. In other words, that you or the person you are caring for has a consistent pattern of when they move the bowels. The bowel motion should be soft and the person should not have to push or strain to pass a bowel motion.
How do you identify a bowel habit or pattern?
The use of a bowel diary can help to identify a person's routine or pattern. To do this, simply record how often and at what time the person empties their bowel over a 7 to 10 day period. Other information, such as what the bowel motion looks like and when soiling incidents occur, can also be useful. After completion, review the diary so that you can identify any bowel pattern.
Is there anything we can do to help establish a regular bowel habit?
Well, the best time we move our bowels is either first thing in the morning or 15 to 20 minutes after a main meal. So it's a good idea to go to the toilet at these times and plan for them within our daily schedule. If the person you support has not had a hip replacement, then using a footstool in the toilet can also be useful, as it positions the body to empty the bowel more effectively. Place the person's feet upon the footstool while they're sitting on the toilet. Ensure that the knees are higher than the hips. The person should lean forward with a flat back, elbows on their knees. If some effort is required to pass a bowel motion, then they can pretend that they're blowing up a balloon. After moving the bowels, ensure that it is easy for you or the person you are supporting to reach the toilet paper for wiping. These little things make it easier to manage bowel continence at home.
What about fluid, fibre and exercise?
Encouraging a good fluid and fibre intake can also help ensure a regular soft bowel motion. Ideally, we should drink 30 ml of fluid intake per kilogram of weight or pass between 1.5 and 2 litres of urine each day. Research suggests that we should have an intake of 30 grams of fibre a day, so including the higher fibre foods in our diet is great. Remember to have 5 portions of fruit or vegetables each day and make a point of planned servings of these fibre-rich foods. Some people have a kiwi fruit every day without fail, while others find the mixture of stewed prunes, apples and bran works just great for them. What is important to have this bowel food consistently so that the bowel motions are soft, regular and easy to pass. Daily movement or exercise will also help to move the digested food along the bowel. Even standing beside the bed, holding onto a walking frame and gently grooving to Lady Gaga or Glenn Miller for 10 minutes will help move your bowels along and keep them regular.
What other factors can contribute to bowel problems?
Other factors that can lead to bowel problems include the side effect of medication, reduced mobility, some medical conditions, a change in the diet, an infection, ill-fitting dentures which make it difficult to eat, discomfort when moving the bowels due to hemorrhoids or piles, and even embarrassment when having to perform what is such a private activity in the presence of another person. Talk to your doctor, your nurse or even your dentist if the person you support is experiencing any of these problems, or if they've had a change in their regular bowel habit, which may be an important symptom for a serious condition such as bowel cancer. Ensure that your doctor is also aware of all the pills and medications being taken, as those purchased from the chemist or the health food shop can also affect bowel regularity.
Tell me about constipation and fecal incontinence.
Constipation can be caused by an irregular bowel habit, causing hard bowel motions which are difficult to pass. This means that the bowel habit is not regular, the bowel motion is not soft, and you're having to push to go. If constipation becomes a concern, this can affect bladder control and increase episodes of bowel incontinence or result in an impacted bowel, a bowel full of bowel motion. Fecal incontinence is a symptom of an underlying condition and is not a normal part of ageing. This needs to be properly assessed to identify the causes and treatment options.
How can a normal bowel routine be regained?
A good starting point is to consider when the person you support has gone to the toilet in the past, so that if the person you're supporting always went to the toilet every morning, you can begin by taking them to the toilet at that time of day. Keep a track of their progress by recording when the person has a bowel motion in a diary.
How should we deal with a bowel accident at home?
Establishing a regular soft bowel habit can prevent problems or bowel accidents, but sometimes accidents will happen. Whenever this occurs, be sure to clean the skin promptly. It's a good idea to have some emergency supplies for cleanups in a bag stored by the bed or close to hand. This emergency kit may contain disposable gloves, toilet paper or wipes, a bowl for washing, skin cleanser or soap, a skin barrier ointment, spare clothing or night attire, fresh continence pads or briefs, a container to use if the person needs to pass urine whilst the bed's being changed, towels to wash and dry, plenty of plastic bags for soiled items, antibacterial and odour remover spray, and don't forget your hand sanitizer gel.
What do we do when an accident occurs?
Be sure to have everything you need before you begin. Gather your supplies next to you on a stand or a table so that they are within easy reach. Wear disposable gloves and use toilet paper or tissues to collect any solid fecal matter. Place these into a plastic bag to be flushed down the toilet later. Change your gloves as often as is needed, placing the soiled gloves into a bag for waste disposal. Large size wipes or nappy wipes allow for quick and easy cleanups and may be a better choice than paper when dealing with fecal incontinence. Once the bulk of the fecal solids have been removed, the person may be moved onto a clean towel. Place any soiled clothing or bed linen into a plastic bag or basket to be laundered later. If it's not possible to use a bath or a shower, wash the person with a bowl of water and soap or skin cleanser. Wipes or cleansers may be less time consuming than using soap and water. Look for nappy or moist wipes that do not contain alcohol or fragrances, as these can irritate the skin. Wash the genital area gently, wiping from the front to the back. After cleansing, dry the area with a soft towel or a hairdryer set on a low setting if the person you are caring for has fragile skin. You can then apply moisturizers or barrier ointment to the areas that can come into contact with urine or feces. Some cleansers or wipes incorporate moisturizers, a product that is pH balanced and is made without dyes or fragrances, which is recommended. Once the person is clean and dry, held them into some clean clothing and fresh continence products, pads or briefs. Then wash your hands and replace the bed linen and bed pads as required.
How should I manage soiled linen?
Wash soiled clothes or bedding immediately if possible. You can soak clothing or linen in an airtight container overnight with a product such as nappy sand and wash them the next day. But remember to remove all solid fecal matter from the clothing or linen before you soak or wash them. Be sure to wear gloves and always wash your hands thoroughly with soap and water or an alcohol-based hand sanitizer gel after removing the gloves. Replenish your emergency kit as needed to ensure that all items are ready just in case another accident occurs. I hope this segment of our Managing Continence at Home series has been helpful. If you have any further questions, you can phone the National Continence Association helpline Monday through to Friday during business hours on 0800 650 659. Thanks for joining us at Caring at Home.